I'm going to get started. Hello, on behalf of Healthwatch Camden, I would like to welcome you all to this event. It's wonderful to have so many of you join us this evening. My name is Saloni Thakrar. I'm the Chair, Board of Trustees for Camden Healthwatch. We have about 400 participants registered for this event today. Because we're such a large number, I want to go over a few housekeeping rules which will help us make sure the meeting runs smoothly. Everyone joining us today will stay on mute and will remain on mute throughout the event. Apologies in advance for this. If I can also request that you turn off your camera and your video, this helps improve your online connection and means that you can find and see the speakers and the interpreters easily. There is also no chat function working for the meeting today. This is because we are so many of us today, and the messaging helps to reduce and minimize any distractions and allows us to keep up with the questions. The meeting is also being recorded, so you can listen again if you miss anything. Also, we will be providing a full transcript of the meeting on our website at a later date. I would like to introduce our two British Sign Language interpreters, Colette and Russell. Hello, Russell.
Hi there, how are you?
Hello, Colette.
Hello.
Thank you. You may wish to pin the interpreters so they stay large on your screen. Colette and Russell will also be swapping throughout the session. We will be tweeting this event. You can follow at Healthwatch Camden for live tweets throughout the meeting. Please tweet about the event, tag HealthWatchCam, and use the hashtag #AskYourLocalHospital. Thank you. This is a question and answer session. Thanks to all of you that have sent in your questions. We have received hundreds of questions, so we cannot get to all of them. So I'm going to ask 20 questions based on those that you've sent us, and I hope we'll manage to cover all of the issues that you've raised. We'll also be sharing a full list of the questions with both hospitals afterwards. And finally, here to answer your questions, I'm delighted to introduce Kate Slamek, Chief Executive of the Royal Free Hospital, and Marcel Levy, Chief Executive of University College London Hospital. Perhaps, Kate, Marcel, you'd like to take a minute to introduce yourself? Thank you.
Good evening. Sure, thank you. Good evening, everyone. My name is Kate Slamek. I'm the Chief Executive of the Royal Free Hospital, part of the Royal Free London Group. It's a real pleasure to be here tonight. Obviously, we serve a big portion of Camden alongside my colleague Marcel at UCLH, and we're looking forward to answering your questions tonight.
Thanks. Marcel?
Hello, good evening. I'm Marcel Levy. I'm Chief Executive of UCLH. I'm also a practicing consultant in acute medicine and hematology in the hospital. It's fantastic you're all here, and we're very happy to answer your questions. I'd like to thank you very much 3 times. First, for your support in the intense, difficult months that we had during the first COVID peak. In the second place, I'd like to thank you for attending this meeting because we want to give you some information that may be important for you. And in the third place, I'd like to thank you for your patience, because we all know that it's not so easy to get all our services back online. And sometimes it takes a little bit of time, and I apologize for that on behalf of UCLH and all the other hospitals in North Central London.
Thank you. Kate, Marcel, just to remind you to keep your videos on, and can I please request that anyone else who's not speaking, please to switch off your cameras so that we have a better online connection. Thank you. So to get us started, I'll start off with the first question. Our first one is for you, Kate. Are the hospitals starting to do regular appointments again. When can we expect things to get moving, and how long will we have to wait? What's the backlog?
Okay, thank you. That's a really good question, and a question that lots of people are asking, so it's a very good place to start. We're making really good progress now in terms of appointments. We're getting up to about 70%, seeing about 70% of the activity that we were seeing before. And we've obviously started with the most urgent cases that during COVID weren't able to come in and be seen. And then we're now broadening out the invites and hoping to get up to nearly 100% over the next few weeks. Most of our appointments are done virtually, so we have a real mixed modality now. So lots of people will be invited for virtual outpatient appointments, which are mainly done face-to-face, where in this way you can actually see the team that you'll be seeing in clinic. And then we are now beginning to bring people in who need to come in and be seen physically rather than just on screen. So that has now started as well. We've worked really hard across North Central London as a group of hospitals to step up our activity in a safe way and in a consistent way across our different organisations. Obviously, safety is of our highest priority, so we try to restart as quickly as possible, but as safely as possible. And obviously, an important part of that is trying to reduce the number of people having to come into the hospital where that's indeed not necessary. Lots of what we can do, it's a good learning exercise for us, can be done remotely, but there are occasions clearly where there does need to be face-to-face contact, and we're seeing that work stepping up as well.
Thanks, Kate. I'm going to move us on to our next question. Marcel, this one's for you. How can I be sure I won't be at risk of COVID-19 infection if I come to a hospital appointment or for a blood test? And what are the arrangements for A&E?
Yeah, thank you. Very good question. I want to assure you that we adhere to the strictest infection prevention control measures. So if you come to the hospital, you'll find it's a different place. So we have introduced all kinds of social distancing measures, separate exits and entrances. You'll have to wear a mask. You will find hand alcohol everywhere. The staff will all wear PPE. If you have to come for a procedure, we will even test you for COVID or ask you for a couple of days to self-isolate. We are intensifying the cleaning of the hospitals much more than we did before. We are doing staff testing. It's actually an endless list. Some of our venues are actually 100% COVID-free, so they are as safe as they can be. And we really urge you to come to these sites if you have an appointment, because they are really safe. If you come to a hospital site which has COVID query and COVID-free areas, you can absolutely be assured that we separate these pathways very, very strictly. So we do everything we can to keep our hospitals as safe as possible.
Thanks for the in-depth answer. Kate, we have quite a few questions on this. How can we be sure that hospital transport, ambulances, cab companies used by hospitals is safe and COVID-19 compliant?
So a bit like as Marcel described in hospitals, which are very different to how they were pre-COVID, we have high expectations of our transport providers as well. And so our hospital transport providers are fully compliant with current national infection and prevention control guidance. And they've put measures in place to make sure patients are safe when they're being transported to and from hospital. So they'll be wearing PPE, the driver will wear a mask, and patients will also be asked to wear a mask throughout the journey. Socially distanced journeys are for patients using transport, making sure there's appropriate spacing in the vehicles. And after each journey, the vehicle is deep cleaned. We also expect the same standards to be met by cab providers. You'll know that often you're asked to wear a mask in a cab, and there's often a bit of protection between the front and the back of the cab. But so we expect that level of that level of quality to be provided in cabs as well. But we have very strict regulations and approaches to hospital transport to make sure that patients are transported as safely as possible.
Thank you, that's really reassuring. Our fourth question again is for Marcel. Should I try to wait? I don't think my condition is so urgent, and I know the doctors and nurses are very busy treating COVID-19 patients. I don't want to be a nuisance.
Okay, let me tell you up front, the doctors and nurses are not busy treating COVID-19 patients. At UCLH, in the last week, we had 0 COVID-19 patients. So we're there for you to help you, especially if you are an urgent case. So we look over your shoulder, all our clinicians triage all the waiting lists, and those patients of which we think it's urgent are being sent an appointment. If you are getting an appointment to come in for as an outpatient or to come in for a procedure, please come and do not wait. That may be detrimental to your health. It's very important you adhere to these appointments.
Thanks. Kate, do you have any thoughts on this? Would you like to add to what Marcel has said?
I would just like to echo and amplify what Marcel has said. Our hospitals are now not full of COVID patients. We have very, very few patients with COVID in the hospital. We have very safe pathways into care. So we absolutely want to make sure that you feel safe coming into hospital, that we're stepping up the activity that we're having to stop over that sort of height of the COVID period. And just to reassure people that the hospital is a very different place to the one that it was a few weeks and months ago. So absolutely the same.
Thank you. Our next question, again, we had quite a few questions, residents asked this. I have breathing problems and anxiety about having things over my face. Will I be turned away from the hospital if I can't wear a face covering? Kate, would you like to answer this first?
Yes, of course. So we obviously want to really encourage people to wear face coverings when they come onto the hospital site. Of course, that's happening quite a lot in the community as well. And when somebody arrives on the site, they will be asked to wear a face covering. However, there are some people, as we know, who cannot tolerate face coverings. So there are things we can put in place to try and make sure that we're respectful of that, and it's really helpful if you let us know that in advance so that we can put in, perhaps arrange you to come in through a different route or support you getting up into the clinical area and not having to, and obviously remaining socially distanced from other people. So we do encourage face masks for obvious reasons, but we can accommodate where obviously it creates problems for individuals to wear face masks. We want to be flexible, but try and encourage most people to wear face masks.
Thank you. Thanks for clarifying that. And Marcel, is University College Hospital doing anything differently with regards to this?
No, I don't think so. So we have our exemptions of people who do not have to wear a mask. The children under the age of 11, actually people who rely on lip reading, people who actually are uncomfortable with masks. It might be helpful if you indicate this clearly to the people in the hospital, because otherwise they will look at you and say, hey, why aren't you wearing a mask? But it's absolutely normal not wearing a mask for these reasons.
Great, thanks. I'll move us on to the next question. Marcel, we had a lot of questions on this topic. When will partners be able to accompany women in childbirth and antenatal scans? And why is this still not allowed when restrictions elsewhere are easing? For example, visits to care homes.
Yeah, I have a little bit of difficulty in understanding the question, because throughout the pandemic, even at the peak, women have always been able to be accompanied during labor by one person. It could be their husband, it could be another family member, it could be any other birthing partner. But only one, because we have to take care of the safety of the other patients and our staff members. We are now extending that visiting right, or the right to be accompanied, also to scans at 12 weeks and at 12 weeks, and also in the fetal assessment unit. So we are extending it, but we have to limit it to one person only.
Thanks for clarifying that. That's really helpful. Kate, would you like to add to this?
So we're in the same position at the Royal Free as well. We actually have a Director of Infection and Prevention Control group in North Central London. So we all work together and try and make sure we're being consistent in our approach to implementing infection prevention control standards. So we too have always allowed a birthing partner during the birth. That has been more restricted around the outpatient side of things, but like Marcel says, we're reviewing that now in the light of things changing all of the time. All of these processes need to be under constant review because life's changing all of the time, so that we can be as flexible as possible but safe at the same time.
Great, I'm really glad we got a chance to clarify that. This next question is for both of you, but I'll ask Marcel first. My appointment was cancelled. I was told it would be rearranged, but I haven't heard anything since. Should I keep waiting? How can I be sure I haven't just fallen through the cracks?
Okay, good question. If your appointment is cancelled and you've been promised that another appointment is coming to you, please wait a few days. I do get emails from people who have been waiting for half a day and then already sent me an email. That's really not helpful. Give us a little bit of time. But after a week or so, you should have heard from us. The best advice I can give you, if you haven't heard from us, is to look at your appointment letter. You'll find an email address, and please send us an email, because that's for us the best way to look into it and to see whether indeed you have fallen through the cracks or whether your appointment is upcoming or need to be scheduled. If you have difficulty in accessing emails and computers, and I do understand that some people do not like that, then please call. But please try email first if you can, because if everybody starts to call, then our lines will be overburdened and we cannot really respond to that.
Thanks. And Kate, what's the Royal Free's position on this?
It's very similar again to what Marcel has just said, to be patient, but actually if a period of time has passed, I think, well, actually clearly, I think I may have been forgotten to ring the number on the letter. If you cannot get through and cannot get satisfaction, you're worried about that, there's always the patient advice liaison service to go through, so if you're feeling that you're not getting through in the way you need to. We're also working, I know Marcel is the same, we're looking at developing a patient portal that we'll be launching in August. It will give people much more visibility and access to appointments, when their appointment is, and be able to sort of liaise around that, which will make life a bit easier. I appreciate that not everybody is comfortable with technology, so that will work for some people, but not for all. But I think it will make the whole system a bit more visible and easier to work with.
Thanks. That's really helpful. The next set of questions are on remote appointments. Actually, this one's again on another appointment one. Kate, this one's for you. Are there processes in place to support patients to manage symptoms while they wait for investigations or treatments that have been postponed?
So we're working across NCL to make sure we can safely restart services in priority order. But if people have concern about their condition in the meantime, if they haven't yet been invited in to be seen, it's really important that they contact their GP, or if they don't have a GP, if they contact 111, and we can make sure through that process that they get the right advice and guidance. And then if there is a need for a more urgent hospital appointment, then the GP will let us know.
Thanks. Marcel, would you like to share your views on this? Is UCH doing?
No, obviously we're doing the same thing. It's difficult to answer specifically because it depends very much on the clinical situation. But of course you can do all kinds of treatment just to at least try to relieve symptoms or any discomfort awaiting any further investigation or any further treatment. This is typically an advice that should be given by your clinician, either the consultant or the nurse in the hospital, or maybe even your GP. So if you're really uncomfortable and awaiting an appointment, there is nothing wrong in asking, what can I do in the meantime?
All right, thank you. Thanks for clarifying that and answering that. Our next set of questions are again on remote appointments. Kate, I had an appointment which was cancelled. I just got a message saying, don't come to the hospital. Why couldn't I be given a telephone appointment?
So I'm not sure when this happened, obviously, because I can't see the detail, but there has been a period of time where we've been having to prioritise people that we were contacting and seeing even virtually. And obviously switching people to virtual appointments where possible, because we need to see probably many more people than we were before in a virtual way rather than in a face-to-face way. So we're trying, as we've said before, we're restarting all of the services that we had stepped down, and that's gathering good pace now. So I think this might have been something that had happened. I would hope that, there'd be better communication at this point. In the height of COVID, people were told not to come to the hospital and a number of appointments were cancelled. But we're now in a different place, and we're obviously inviting people to be seen virtually where that's appropriate, and then inviting people to come in where necessary.
Thanks. And Marcel, what are your thoughts on this? Have things moved on also?
Yeah, everything that we are doing now is relatively new. So just for example, at UCLH, we see 20,000 patients a week. So it's huge. And the vast majority is now by telephone or video consultation. And we're learning. And of course, if you think that a telephone consultation, at least in the meantime, is a solution for you, you can ask for that. And it's easier to schedule that than a face-to-face appointment.
Thanks. And that answer partly answers my next question, actually. Marcel, I'll let you follow up with that. Remote appointments are not always sufficient. For some things, you need to be face-to-face. How are you deciding which appointments are appropriate for face-to-face and which can be remote? And how can you be sure that a remote appointment is not putting our health at risk?
Yeah, absolutely good question. So we are looking at it from the medical side. So we think this conversation can be done by telephone. This is a consultation. We are discussing laboratory results. We are discussing treatment and the effect of treatment. And actually that may be helpful for the patient as well, because it saves travel, it saves waiting time in the waiting room and so forth and so on. But there are of course things that you need to see. Sometimes you just need to examine a patient. Sometimes you have a difficult conversation about therapy choice, which really need to be done face to face. Taking it from the patient's perspective, it may be that the doctors think that it can be done virtually, but that the patient has another idea. And that's also very valid. So it is absolutely normal to say during a telephone conversation, doctor, I really love to see you to discuss this face-to-face in person. We have now the ability in all the hospitals to book face-to-face appointments. So just say it and it can be realized.
Thanks. It's very reassuring that patients do have that choice. Kate, I'd like to give you the opportunity. Is Royal Free doing things differently around this?
No, we're working in a very similar way. It's exactly as Marcel had said, actually. So it's the same. Thanks.
Thanks for that. Coming back to you, Marcel, this question comes again from quite a few residents. I don't feel safe leaving home and much prefer remote appointments while COVID infection is still a risk. Can there be a choice to continue with remote appointments for people who are vulnerable and shielding if we prefer?
Yeah, good question and a very simple answer. Yes, of course. I personally have many patients who are shielding, who do not want to come in, but who do value a conversation about their medical condition or what's going on with the medication or their laboratory values. Yes, they can have telephone conversations. And we will keep doing that in the next months and probably years.
Great, thanks. Kate, what are your views on this?
Yeah, no, I agree with Marcel. I think virtual consultations are here to stay, and some people really prefer them anyway because it saves travel, to and froing into hospitals. So they're a good thing for many people. Some people like them, some people like them less. Of course, sometimes people who are more vulnerable and shielding will need to come in because not everything can be done virtually. And I suppose I just wanted to reiterate, as we've said before, we've put lots of measures in place to make sure the hospitals are safe. We're doing everything to make sure people are safe when they come in, when they're vulnerable. And as Marcel says, we've not currently got hospitals full of COVID, but we've got very strong and clear infection prevention and control guidance with pathways in that are safe and hand sanitizing, masks, PPE, and all the things we've talked about before. So it's about a balance, actually. So if you really do need to come in because your healthcare needs to be delivered physically rather than virtually, we are creating safe environments for people to come into.
Thank you. I've noticed that there are quite a few hands up. We have 400 participants that have registered today, and unfortunately, given the nature of this meeting, I will not be able to take any questions from our participants. However, I will be giving some information at the end of the meeting about how you can get further clarification on some of these questions. So at this time, I'm really sorry, I won't be able to open this up to the participants that have registered. And I know it's frustrating. Moving on to our next question. This is for you, Kate. If I don't have access to the internet, can I still have a hospital appointment?
Yes, absolutely, of course. And we can use telephone appointments, but also, as we've said, we can invite people in to be seen if that's preferable. So in fact, if somebody doesn't have access to the internet, but they don't necessarily want to come in, there's still an option. We've used telephone consultations before and in the past. We've just got much better technology now. It's one of the benefits of COVID. It's made sure we've sort of stepped into a new world of having more, video, ability like this, and we're using it more commonly. But we can still use telephones and we can still invite people in. So it will not affect people's ability to have a hospital appointment. Thanks.
And Marcel, did you want to add your thoughts to this?
Yeah, I fully agree with Kate. The vast majority of our virtual appointments is actually telephone. So video is relatively rare. But yeah, of course we can offer this.
Thanks. I guess there's been so many questions that have come to us on appointments and remote appointments. It just gives us the opportunity to get some clarity around this. Thank you. The next question is, again, we've had a number of different questions on this one. Marcel, video appointments can be really hard for a person with a learning disability. What are you doing to make online appointments easy for everyone?
Yeah, very good question. It's actually not only patients with learning disabilities. I just complained that it took me 15 minutes to get online to this very simple Zoom conference myself. So it is actually not that easy always. So it has nothing to do with learning disabilities. It can just be difficult for everyone. Of course, if it is a video conference, you can be accompanied by a carer or a family member. And we can even accommodate that this person logs in from another location, which makes it probably easier so that you can have a conference like we are having now with multiple people actually looking at each other and talking to each other. So there are several solutions. If there is no practical solution for a patient who finds it very difficult to log in through internet or video, it's much better to do telephone or face-to-face.
Thanks. And Kate, what are your thoughts on this? Is Royal Free doing anything to help with learning disabilities, or for that matter, everyone else that may be struggling with remote appointments?
So I think it's really making sure that telephone or video conferencing isn't the only offer. And we've also developed some information leaflets to support people through the process, and we've developed a video as well that we're making sure it's more available to try and guide people through the options. But like Marcel said, we absolutely recognise this is new for people and doesn't suit everybody. So it's just trying to find the best way of communicating with each individual according to their needs. I'm really careful about that.
Thanks for your answers. Kate, I just have a request. Can you sit closer to the mic because you are cutting out slightly?
Am I? Okay.
That's much better. Thank you. Okay. Thanks. And of course, we have technology glitches while we're doing this too. Our next set of questions are around communication, and we've had loads around this. So the first one is, Kate, this one's for you. And of course, I'll ask Marcel to add to this. Any chance of communication improving? First, to reassure patients they have not been forgotten. Second, to avoid mishaps and misunderstandings about different types of appointments, face-to-face, telephone, or video. And third, to dispel confusion about new systems and procedures. Sorry for the very lengthy question.
No, that's okay. So I think this is all part of the new world we're operating in, and we need to be better about how we share information on our internet sites and various other sites to make sure people know what to expect. I think also on an individual basis, if people are feeling worried, that they should feel they can contact the hospital. As Marcel said, you know, we picked up earlier, if it's around a specific appointment, you want people to give it a bit of time for that to happen, but not to feel that they can't check in and be sure that everything's okay. Going to also checking in with their GP if they're worried about that connection with the hospital being lost. But I think we probably need to think about what else we can do. Having, you know, seeing these questions, I can see there's a lot of anxiety about outpatient appointments and the way we're offering them. So I think we probably need to go away and think about what else we can do, and actually get some guidance from Healthwatch about what you think would be helpful as well.
Absolutely. We'll definitely continue to feedback. Thanks for that, Kate. Marcel, how do you feel about this? Is your approach, what's your approach? Would you like me to ask that question again? There's quite a bit there.
Yeah, so I think communication is of paramount importance, and it's always difficult. So what we try to do is to send out emails, letters, to communicate through our websites, to directly call people. But it is difficult because so many personal situations are specific, and it is hard to make information on websites or letters very, very specific. So please use email if you can, or maybe one of your family members can help you with an email. Email is really okay. It is being answered. We monitor that very adequately in most cases, much better than calling, because calling is, you know, is very, it can be very congested and almost impossible to deal with. But emails, of course, you can organize when you have a little bit of time, and you can do many of them. So try to get your information from the general information means. But if you have specific questions, please send us an email.
Thanks. Thanks for your in-depth answers to both to that question. Marcel, next one's for you. Many non-English speaking patients rely on family members or friends to translate for them. How is language support being provided if people have to come to hospital alone because of the COVID-safe arrangements?
Yeah, very good question. So if you need an interpreter and your family member can provide that and you're happy with that, then that family member is welcome to join you in your outpatient appointment, for example. But if you're admitted to hospital or if you need to have a procedure, that's not always possible. And sometimes there is no family member available for you. So normally we would use interpreter services. They are still available to us, but only by video or by telephone. We will organize that if you need it and if you have indicated that you need that service. It's not difficult to book, we can do it. The only exception is that if there is a very urgent situation which requires immediate explanation and treatment, we will have an interpreter on site. But if not, then we will use telephone interpreters.
Great, that's good to know that you still have that arrangement in place. And Kate, what about the Royal Free? What support and arrangement do you have for non-English speaking patients?
Yes, so we have quite a wide range of interpreting services with qualified interpreters. And actually, if you arrive at an appointment and you haven't come with somebody, you can request telephone interpretation on the spot. Face-to-face needs to be pre-arranged ideally. We've got sign language interpreters. We've got quite an array of interpreting services that we can access quickly and expediently.
Brilliant. And even at the time of an emergency?
Yes.
Great, thank you. Kate, our next question is, face coverings make it hard for deaf patients to lip read. Can you make sure all hospital staff use clear masks and have a deaf awareness training?
So we think it's been a real issue for staff for patients, who are hard of hearing or deaf. COVID, hasn't it, with people wearing masks? I think it's been very difficult. And there's a lot of work going on looking at clear masks, and we're looking at whether we can get a number of clear masks so that people can see people's lips and mouths. So we're really working on improving this, because in the rush of everything through COVID, I think people who are hard of hearing or deaf really struggled with all the PPE, not being able to see people's faces and not being able to see people's lips. So we're looking at a range of communication options, which clear masks where possible, as well as visual aids, writing things down, speech to text apps, sign language. We're trying to really think of a sort of rounded approach to how we can support people through this period, given the need to wear masks.
Thank you. And Marcel, what's University College Hospital doing, and what assurance can you give us around this? Because deaf people really struggle with this.
Yeah, absolutely. And it's a fantastic example, actually, where patients tell you where you have to improve, because I didn't think of it for a second when we were in the middle of all this. So we try to source a transparent face mask. They do exist, but they're very, very difficult to get. We have very active procurement across NCL, so we try to share between the different hospitals, but it is still very scarce. So it will probably be better in the next few weeks and months, but at the moment it is a problem, and we have to use alternative means for properly communicating with our patients.
And in the interim, in the absence of the clear masks, what arrangements do you have in place?
Well, in some situations you can keep distance from your patients, and you can use perspex masks. So so there are creative solutions, and we need to also make. I mean, we do not need to exaggerate. Masks seem to help a little bit, but they're not the holy grail. So not wearing a mask during a difficult conversation can be totally acceptable.
Thank you, and thanks for the efforts around this. We've also received several questions around some other questions, other topics. Marcel, this one's for you. Is there visible leadership in tackling racism wherever it exists across the hospital trusts? Is unconscious bias training part of hospital staff and medical training?
Yeah, good question, and a very topical point. We do have a BAME advisory group that actually tells us how we have to change our practice, how we may actually have unconscious bias, or how we can prevent unconscious bias. We even have a BAME COVID group, because we all know that BAME staff is more vulnerable to COVID and needs risk assessment to see how they can safely do that job without being ill or without having an increased risk when working in the hospital. So yeah, we try to listen. We try to do this in a comprehensive way. And comprehensive, I mean, we do not want to have any inequality in the hospital, but I think BAME gets specific attention nowadays.
Thanks. And Kate, what's Royal Free's position on tackling racism wherever it exists across the hospital staff? What's your approach to this?
Okay, so we take a very strong position on this as well, as does Marcel. So we stand together with our Black staff, minority ethnic staff, volunteers, patients and community against racism and hate crime. We're really proud of the diversity of our staff. We have an incredibly diverse workforce, and that enables us to provide excellent care to our patients. So we do participate in unconscious bias training as a senior leadership team, and staff receive it as part of training, but that's only one of many measures, of course, that are going to make a difference. We have a thriving BAME staff forum established in 2014, and they work with us to ensure that we are reaching out in the right way and doing the right things and supporting our staff right across the board. We are really committed to equality, diversity and inclusion across in our workforce, and we've got a number of initiatives in place to make sure that we have a representative workforce. So our workforce looks like our local community. So we're applying fair recruitment selection processes, equal pay of work for equal value. training and development opportunities for staff, monitoring take-up across our different ethnic mix of our staff, making sure staff are free from abuse, harassment, bullying and violence from any source while at work. So I can go on, there's a lot of work going on in this space. It's really important for the NHS, it's really important for both of our organisations. It's something we take very seriously, and we sort of stand firm alongside our staff to make sure we're providing care in a fair and an equal environment, and very aware of the issues and addressing them.
Thanks, and thanks for your really thorough response on this. This is a really topical conversation, and you know, especially given the recent events. So really appreciate your answers to that. The next question is, are the hospitals offering additional support to local residents from the Black, Asian, minority, ethnic groups and disability communities as part of the recovery pathway? Kate, I'll let you start off with that, with answering that.
So we're taking many steps to support these communities. So we're looking at equal access groups, and we'll bring together a number of groups, including Camden Disability Action, British Somali Community Centres, Voluntary Action Camden, in the coming weeks to get in touch with current members about this. We want to hear, you know, of people who are interested in joining the groups, so we'd like to work with you with regard to that. Access to virtual appointments, we're very aware that not everyone has access to technology, so we've talked a lot about that today. And to help overcome this, we're looking at setting up drop-in sessions in the community where this technology is available, so people can have their appointments virtually where they want to have those virtually. So we've got, obviously there's work we're doing with supporting people with disabilities, and we've got a disability action group, and we're also looking at hospital passports, so people who come in and out of hospital are more vulnerable, so that that we know more about their conditions, so they get more continuity of care, easy to read information on the website, and easier discharge information and booklets. We're sort of doing a lot of work around communication there as well. So there's a lot of work going on in this space. There's always more that we can be doing, but I think there's more we need to do to connect up with our local communities to sort of get this absolutely right.
Thanks. And Marcel, how are you doing things differently? What's your approach on this?
Yeah, I agree. It's not very different, but I'd like to add something. So not only for the BME and inability community, for everyone who had a COVID infection, we are learning that some patients have a very prolonged trajectory of very severe complaints. Could be respiratory complaints, could be musculoskeletal complaints, could be severe fatigue, could be mental health complaints. And we are learning, we need to understand it, and we need to support all these patients, not only those who have been admitted to the hospital. It could also be a relatively moderate COVID infection that you experience at home. So we are starting clinics, that multidisciplinary clinic, where we look at these complaints, where we actually try to address them with physiotherapists, with mental health support, with respiratory physicians, not only for patients who are admitted in hospital, but also for patients in the community, and GPs can refer patients to these clinics.
So COVID-19 has really highlighted some of the gaps, which really gives you an opportunity to address this as part of the recovery pathway. Thanks for your answers on that. Will we be able to volunteer at the hospitals again in the future? Kate, that's for you.
Yeah, so we're really looking at how some of our volunteers have come back. We have an enormous volunteer community at the Royal Free, and they undertake a fantastic job supporting patients, staff, various services. So we're beginning to step that back again. You know, as Marcel and I have both said, the hospitals are very different to the way they were, how they were before, much more COVID-free, and pathways to create safe pathways through the organisation. So we're feeling more able to invite people back to volunteer in the organisation. So that is lovely to see our volunteers coming back. So absolutely, we want to see that returned and invite people back in to volunteer. We're doing that and making sure something that's worth mentioning here is we undertake risk assessments, COVID risk assessments for all of our staff, obviously all of our volunteers, to just look at sort of the risk factors associated with COVID around individual risks, and making sure we can mitigate those appropriately, so we're not putting people at any risk in terms of the areas they may work. So that's a really important part of what we're doing. But yes, I think we can see opportunities to bring our volunteers back, which is really good.
Great. I'm so glad. We've had quite a few questions on that. And Marcel, what about your volunteers?
Yeah, it's absolutely the same. We very much rely on volunteers almost everywhere in the hospital, and they're now slowly coming back. But let's not forget, even during the COVID peaks in April and May, we had a small army of volunteers who were still in the hospital and helping people who needed some support with whatever, and helping staff actually. So we very much value our volunteers, and we want to see them all back.
Wonderful, that's great. Our next question is, and it's our last question, we'll have an opportunity to add to some of the other areas that we've not been able to discuss, is what will COVID-19 mean for the future of the NHS, both in terms of funding and priorities? Marcel, would you like to answer this first?
Okay, I think COVID-19 has clearly demonstrated that we need an NHS, and that we do have an NHS which works properly and which can really step up and provide care for very sick patients if we need to be. But we all realize that a lot of patients did not get care during COVID, and now we have these big backlogs. I think that's the next challenge for the NHS. And I'm completely confident that we will get on top of this. We will need a little bit more funding to do all this, but eventually it's not up to us, but it's up to other people to decide whether we will get the money to do our work properly.
Thanks. Kate, before you get started, would you mind, again, your audio for some reason?
Okay, sorry.
No, we're at the mercy of technology here, so I think that's a little better, but thanks. Yeah, we'll give it a try now.
Thank you. Yeah, so I think a lot has changed as a result of COVID. I think we know obviously how important our hospitals are in our local community. We've worked really effectively as a group of hospitals in our sector, so we've all worked together. And there are things that we're changing that I think will change for the future and strengthen our services across our patch. Obviously, we're doing more things that virtually, which we weren't doing before, and some of that's I think is good for patients because it's not making people travel as much as they were travelling before, so giving us more options to work differently and safely. So I think there's a lot of good change that's happened, a lot of collaboration that's happened that we'll just want to continue with moving forward, and we'll need to continue with in terms of moving forward and ensuring we're continuing to offer safe services for our local community.
Thanks. Thanks for that. There's a lot there. That was a very broad question. Given the time, I know we can't go into much detail. I wanted to ask, we've covered quite a few areas here, and I wasn't able to get to both of you. And there were some questions, of course, where both had an opportunity. Was there anything that you wanted to add, both around the work with COVID, but of course more around the recovery? Was there anything else that we may have missed that you wanted to share with us? Yes, Marcel.
Well, there's many things, but one thing that's very close to my heart. So I think, to be honest, and Kate already alluded to it, I think the hospitals did a good job during the COVID peak. But there's, of course, things that we can improve. There are a lot of things that we can improve. The thing that's really nagging me all the time is whether we got it right with visiting rights for admitted patients to the hospital. I found it really difficult to see patients on my wards that were very, very sick and could not get any visit from their family members. And of course, we had all kind of creative solutions with iPads, telephones, and whatever we did. But that's not the same as having your loved one holding your hand. So I really think we need to have a discussion whether we want to keep this visiting policy up, even if we have next peaks. And I would value to hear from patients actually, and family of patients, how they feel about this. Because for me, this was one of the most difficult things in the past few months.
Thank you. And that's that's a very, very personal issue, I'm sure, with quite a few people that have gone through this, and I'm sure also very challenging for staff having to be there for very sick patients, but also communicate that with family members. Kate, was there anything that you wanted to add?
If I could come off the back of what Marcel's just said and then broaden it out. So, I mean, I think that's right. That's been a real one of the most challenging things during this COVID period, is the sort of people not being able to be with their loved ones. We actually have found a way forwards that doesn't necessarily resolve that fully at the Royal Free, but we've become much better at communicating through iPads, families talking to each other, and being much more structured in the way we update families around care, which we were not very structured about before. So we've had lots of positive feedback from patients and their families about that. But just broadening out the wider question, I think we've been through an enormous experience over the last few months, and none of us were prepared for it. I mean, we have an element of preparation to any events and pandemic events, but we were never quite expecting what we have been through. And of course, we won't have got everything right. And there's a lot of learning we need to do afterwards around communication, how we do that better, how do we connect up better with our local communities. So I think there's loads of learning still to come. So as Marcel said at the beginning, thank you for everyone for their patience with us, because I think we've been through an enormous thing. We're coming out the other side. We're trying to step services back up safely so that patients are not being put at unnecessary risk. We've always got a slight concern that, you know, what's the winter going to be like? Is COVID going to step back up again? So we've got to balance all of those issues. Staff have been amazing, and we need to support staff and allow them to go and have a break and come back and be refreshed. But just thank you to all of our local communities for being so supportive. We've got incredibly supportive through COVID. We've got lots of donations of food, and people were amazing, and it really helped carry us all through it, really. But we know this is now a rebuilding phase, and we need to learn from what's gone from the past and what we need to do better in the future. So thank you for the opportunity this evening to work through some of those issues.
And you know, just to acknowledge, thank you for your openness with this question. You know, to say that, you know, the learning, the uncertainty, the not knowing whether you got it right. There's a lot to absorb, a lot to learn, and a lot to, you know, take forward. So thank you for answering that. And lastly, so many people have sent Healthwatch Camden questions for this event, hundreds. We have tried our best to get your questions, all the participants, you know, that registered today. Many of you won't have heard your own question, but I hope you have heard answers that have captured something of what you wanted to know. Kate and Marcel, if people have concerns or want further clarification, where should they look for answers?
Good point. Well, some of the information will be given on websites and on, you know, public information channels, but I fully admit that probably people have already looked there and didn't get an answer to their question. I think everybody should get an answer to their question. It's all about communication, and so that we can actually try that people understand what we're doing, and that we're doing our best, and that we cannot do everything at the same time, but that we haven't forgotten about them. I would actually ask people to combine their questions. Maybe Healthwatch can play a role there, maybe someone else, and just send them to us, and then give us a little bit of time. We can probably combine many questions that are the same and provide answers, and send them back to Healthwatch and publish the answers and the questions on our websites. We're quite keen to explain to people what we're doing and why we're doing it. So questions are welcome. It is easier for us to answer general questions. If it's very specific about you or your specific condition, it's much more difficult. And then it might be better that you address your GP or your consultant or the service you're under. But if it's a very general question about how the hospital works, very happy to spend some time in answering these questions. Thanks,
Marcel. And Kate, would you like to?
Yeah. So I echo absolutely what Marcel says, and of course, Healthwatch, you have a role to help us, you know, this has been really good. I think you'll know the sort of things that people are struggling with, and we both work with you. We both share Camden as a local geography that we both serve. So if there's anything we can work with you on as well to perhaps, as Marcel says, deal with some of the commonly asked questions, frequently asked questions that people are struggling with, that we're very happy to be supportive and engage with that.
Thanks. We will absolutely be sending you a full list of all the questions that we've received. I think there's a lot here that we can learn from. Yeah.
Absolutely.
So we're almost at the end of our meeting. Kate, Marcel, thank you so much for answering our questions so openly and clearly, for taking the time to join us this evening. I'd also like to extend a deep gratitude and thanks to all your staff at Royal Free and UCH and your volunteers, especially for their care, their dedication, their support and commitment is over the last few months. And just to say, for all our participants, thank you also for coming and joining us this evening. I know I found it rather awkward and frustrating not to be able to see you or hear directly from you. And I apologize for not being able to answer your questions. It's the nature of this meeting. And before I end the meeting, I want to invite everyone to switch on your cameras. So if you want to, so you can wave goodbye. So we'll take a moment so we can all see each other and wave goodbye. Thank you so much for joining this evening. Thank you, Kate. Thank you, Marcel. Thank you, everyone. Goodbye.
Thank you.
We'll now end the meeting. Thanks.